All right, for our final section or sections, actually I'm one section ahead already here. For chapter 1, we're actually going to discuss homeostasis. And I think we can get this done in one fairly short little video. But we're going to talk about homeostasis to finish up our chapter 1 for organization of the body. And in talking about homeostasis and keeping internal conditions stable, our primary objectives are going to be to define the components of a homeostatic system, be able to recognize each component in representative systems, and define negative feedback. Okay. Furthermore, to explain how homeostatic mechanisms are regulated by negative feedback and to detect and respond to environmental changes, define positive feedback, how it differentiates from negative feedback, and describe the actions of a positive feedback loop. Okay. Now, starting with homeostasis, we're basically talking about homeostasis is the ability of an organism to maintain a consistent internal environment in response to changing internal or external conditions. Your body is always in a state of flux, trying to maintain given set points for a particular system. Okay, every system having its own controls, at the same time having a center of controls. We talked about the whole idea of going from atoms all the way to the entire organism, right? Understanding along the way, there are various controls along the way. They're trying to maintain your pH, trying to maintain specific blood flow, trying to maintain temperature and pH, to the biggest ones in a constant state of flux, that your body is trying to maintain certain levels, and its ability to do so will greatly affect positively or negatively your ability to respond. But we don't want to confuse positive and negative feedback in the same way you think of good and bad. We'll talk about that here in a moment. In terms of the homeostatic system, the components of a homeostatic system, we're essentially talking about a receptor which detects changes in a variable, and it basically you get a stimulus whereby there's a change in temperature sensed by the skin. So the receptor sends information to the control center. The control center interprets or inputs the input from the receptor and then initiates a change through an effector. Nervous system can do this. It provides a very quick response. Nervous system can respond much quicker than the endocrine system. Endocrine system, well, both endocrine and nervous systems are both responsible for regulation and controls. There's a much faster response coming from nervous system from a general standpoint to the immediacy of now, whereas endocrine system is more sustained and long-term, although they both play a role in pretty much every response. That said, for the most part, an effector is basically the structure that brings about the changes after the stimulus, to alter the stimulus, So you've got your receptor sensing the information, the control center determining what to do, then the effector enacting what the control center tells it to do. So you have here, get this a little closer, for the components of a homeostatic control mechanism. We have our stimulus. There's a change in a variable, like a change in temperature or a change in stretch in muscle. There's a receptor that's basically sensory neurons in the skin, or stretch receptors in the muscle. In this case, something like the Golgi tendon organ or the muscle spindle would regulate what's happening, or basically sense what's happening and give a response for what's happening in the muscle. But that said, there's a change somehow in either tension on a muscle or temperature change. The receptor sends information to the control center, and if the receptor and control center are separate structures, in some cases they're not, the control center integrates that input and initiates a change through the effector, which is usually a brain or endocrine gland, something in the nervous system, or a gland, right? Stimulating a hormone, or something to stimulate another gland to stimulate a hormone. The control center sends output information to an effector, and that structure then, the muscle or the gland, generally speaking, brings about a change to the stimulus, and ideally homeostasis is restored. At least that is the goal, right? Unfortunately, it doesn't always happen. And that's where disease and problems occur when the body cannot reestablish homeostasis, or has difficulty in trying to maintain homeostasis over extended periods, right? So homeostatic systems regulated by negative feedback. Typically speaking, negative feedback controls most processes of the body. The variable fluctuates within a normal range around a given set point, like a body temperature. 98.6 is often referred to Fahrenheit for a body temperature for a normal human being, although the reality is people can vary even into the high 97s to not typically in the 99s, but they could go down a little bit and up a little bit from that being their normal temperature, their normal homeostasis. That's why it's important whenever we're assessing anyone from a general standpoint, the more time we've spent with that person or know enough about their background to know what's different for them. You can't make the assumption that every single person's 98.6 is their exact homeostasis. That could vary a little bit, right? So you have to understand that. That being said, if temperature drops or rises, either way, negative feedback is basically negative feedback loop is going to be incurred trying to return the body back to its normal temperature, and that's what homeostasis, that homeostatic balance that the body is seeking. Okay. Positive feedback, however, occurs much less frequently than negative feedback. The stimulus is reinforced to continue. So your body says, let's keep going with this. Breastfeeding or blood clotting or labor. In breastfeeding, the body's going to be stimulated to respond to assist the process rather than to go against it. Like temperature change, going too cold or too hot, your body may sweat or shiver, in some capacity changing blood flow to affect temperature to try to return it back to normal, whereas something like breastfeeding or blood clotting, trying to stimulate the clot, trying to help the process along rather than trying to go against it to actually return back to homeostasis. We'll talk more and more about this. One example here is, in fact, the breastfeeding. Baby suckles at a mother's breast. The receptor has sensory receptors in the skin of the breast detecting the suckling, and that sends impulses to the hypothalamus in the brain. Hypothalamus signals the posterior pituitary. We'll talk a lot about the HPA axis as this course goes forward, with a very common response for any kind of stress in the body. That hypothalamus signals the posterior pituitary to release oxytocin. And the oxytocin is that kind of feel-good chemical that it's known for a mom to have in regard to the baby, to be able to assist with not just breastfeeding, but how they deal with both psychological and physiological variables with newborns, right? When oxytocin is released, that stimulates the effector for the breast to stimulate and to eject breast milk. At least that's the goal here. And then breast milk's released, ideally, baby feeds and continues suckling, a positive feedback loop occurs. Okay. Now, that said, if you list and describe 3 components of a homeostatic system and give examples of each in the human body, you can refer to basically the breastfeeding, or you can refer to the idea more of a negative feedback loop and returning temperature, or helping assess some other process, which both situations that doesn't incorporate positive feedback. 3 components are basically the receptor, then the control center, then the effector, right? On a cold day, what are some of the strategies the body may use to conserve heat, to conserve it? If it's cold, your body may shiver, trying to return back to homeostasis, right? Actually going to redirect blood flow. So blood flow is going to be directed more internally toward the organs, so your skin gets cold, as opposed to more toward the skin layer. That being said, trying to protect the internal organs, and so your skin may get cold because it's colder out. However, your body's helping you by keeping your internal organs, which are much more important than your skin from a general standpoint, comparing the two, right? So that may be one of the strategies your body uses to keep yourself from getting too cold and actually getting hypothermic, among other things. What's the main difference between a homeostatic system regulated by negative feedback and one regulated by positive feedback? We want to remind ourselves that, again, it's not good or bad. Matter of fact, that is really inconsequential in this case. Negative feedback is system is being thrown out of balance and your body is trying to find a way to return it back to balance. So it's a negative response to the stress, whereas positive feedback is your body's trying to encourage that stress by helping it along further down a process to achieve a specific goal. Okay. As far as the general relationship of maintaining homeostasis to health and disease, from a general standpoint, it's typically more of a negative feedback response, right? And if the effector or the control center or the receptor are unable to do their job properly, the receptor may not properly sense a change, or maybe an issue with that sensor operating properly, or receptor, excuse me. And then that information then going from that receptor, if it's received at all, going to the control center may get the information, but then either give an improper response or no response at all. These are negative responses, or why people have disease in terms of what should normally be dealt with by the body, and the body has difficulty doing so in some situations. And then, of course, as far as the effector goes, the effector may be told what to do by the control center. However, the effector may not be able to carry out that job. The job is too daunting, too difficult for the receptors to, or the effectors, excuse me, to be able to carry out for any number of reasons. People who are diabetic, it's exactly a situation whereby there may be a receptor issue, sensing the level of glucose in the body, maybe a control center issue, the ability to secrete the proper levels of glucose, the proper response, as far as insulin to take up the glucose. Or effector-wise, there may be the inability to, despite the body recognizing what it needs to do, the ability to actually respond, an effector issue. So a summary of homeostatic system characteristics: it's dynamic, it's always in flux, always responding. Like you set your temperature in your house for your thermostat at a certain temperature, and you probably have it on. Probably have to pick between cooling or hot. Your body doesn't pick; it just decides that it'll adjust. You have a certain temperature it wants to be at. It'll adjust one way or the other, trying to balance something within your systems to be able to keep that temperature, right? Whereas you can only set one or the other, cool or heating, for your thermostat at home. Not as complex, not as capable as your system is internally. Generally speaking. That said, the control center is typically the nervous system or the endocrine system, a glandular response, secreting hormone, nervous system with sensory responses with neurotransmitters for muscular responses and other responses. And of course, three components again are your receptor, control center, and effector, mostly through negative feedback. If that fails, as we mentioned, homeostatic imbalance can lead to disease, certainly short-term problems, potentially long-term problems. Like anything, the longer a system is out of homeostasis or unable to return to homeostasis, the longer that stimulus occurs whereby either the receptor, control center, or the effector cannot properly respond, or maybe the stimulus is just too much for the response. Whatever the case might be, it's either going to become a short-term or long-term problem. Right? Less severe to more severe. And typical variables that are mostly consistent with most humans: body temperature around 98.6 degrees Fahrenheit, with some variance there. You can see here blood glucose is not an exact number, between 80 to 110 milligrams per deciliter. Blood pressure, the systolic being anywhere between 90 to 120 millimeters mercury, and the diastolic being typically 60 to 80. If it's above either of those numbers or below, there's potential risk, right, for all these variables. And of course, this is determined by sampling healthy individuals in a population, which is why it's not exact. Normal range is value for about 95% of individuals sampled. There's about a 5% variance where they can vary a fair amount from these numbers. That being said, diabetes, as I mentioned before, is an example of homeostatic imbalance, incapacity to be able to either sense the information properly at the receptor site, to have a proper control center response, or it could be multiple, having a proper effector response. Okay. When these mechanisms are thrown off in function, it becomes dysfunction, right? With blood glucose fluctuations and high glucose readings, and the difficulty that we will face in any situation, whether we're talking about diabetes or any disease or inability to maintain homeostasis, is getting the proper response. And treating patients involves finding a diagnosis, right? In general, treating anyone, working with anyone, involves diagnosing the problem, figuring out where the problem's coming from, the specific cause of the homeostatic imbalance. Medications, as an example, have benefits and side effects. Every response has risks and benefits. And to be an effective professional at any area of science and medicine, or any derivative of those areas, anything you may go to down the road, or maybe you're just going to use some of this information for a different field, maybe you go into business for yourself, not even involved in specifically the science field or health or medicine, whatnot. That being said, we need to understand that every situation that is out of flux, there are risks and benefits in our response. And the more information we have to understand what's going on from a homeostasis standpoint, what the body is trying to get to, where homeostasis is, and understanding specifically in that specific system, let alone the organism as a whole, what effectors may be thrown off, receptors or control centers, will have a greater ability to be able to help and hopefully reduce the negative responses, or better way of putting it, we don't confuse homeostasis with risk and benefit as a whole, to reduce risks while improving benefits. And developing a diagnosis that we mentioned before about the scientific method, and actually evaluating data, forming a hypothesis, and then of course evaluating what the results of that hypothesis for the data, further data, continuing to move along that process, never really being convinced with great certainty that it's always the same. Depending on the severity of the issue, of course, we're going to respond differently, be more likely to make a quick response, but it's a much more detailed diagnosis. But those are things we have to weigh. It's not simple. It shouldn't be simple. Examining patient and gathering data, whoever you're working with, initializing that hypothetical diagnosis for the initial one, and to see if it varies based upon further tests and evaluation of what you find from those tests, and of course hopefully finding a definitive diagnosis, at least as definitive as can be, right? Drugs can affect normal homeostatic control. Patients with depression may have lower levels of serotonin in their brains, and that's going to throw off dramatically their response to stress. And basically, drugs block reuptake of serotonin into nerve cells, thus prolonging its effects, and they can actually help elevate mood or patients with depression. Side effects can also be used to, or serotonin is used in nerve cells of the digestive system, so it can throw off your digestive system if serotonin is not responding properly. Digestive system then becomes more excitable, and then symptoms include nausea and upset stomach. And lastly, a little view of 6 different potential ways to kind of observe what's going on internally. Radiography, which is really an X-ray, right? You'll be typically looking more toward bone and bone response, and you can get some idea what's happening with soft tissue, but generally speaking, it's more looking at bone structures and how bone's being affected. Computed tomography is typically more of it's a horizontal or transverse plane cut, and using X-ray or ultrasound to see what's going on. Then magnetic resonance imaging, it's much more detailed, and typically here, as we're showing here, again, a transverse plane cut, but you can see a deeper look into internal structures and organs than you would get from a computed tomography in this case. This typically is using magnets along with basically radio waves. Okay, sonography using sound, like an ultrasound, to be able to see actual time movement, what's happening, what's occurring. Pretty cool stuff if you had the chance to see a baby basically and actually see the heart beating, actually see it on the picture based to an ultrasound and sonography. Pretty cool stuff. Digital subtraction angiography is able to see in real time like blood vessel response, and actually be able to see what's actually going on at a much deeper level than can be from other images. Okay? And then a positron emission tomography, and also this is very invasive, I should say. Digital subtraction angiography can be painful. It can be very, very invasive. There's potential for damage to tissues, so there has to be a real solid reason for seeking such a test. As much as it might be nice to go for the most significant test, it's also a very expensive test, but certainly one that's actually looked to in situations where difficulty is there's greater life and death type situations involved, or inability to be able to see what's going on, and there's fear for great risk, right? The positron emission tomography, or a PET scan, uses a tracer to be able to see over the period of time, 20, 45 minutes, somewhere up and upwards sometimes, to see what's going on. The more still the person is, you get a better idea what's going on, to actually see with the tracer how the body's responding to that tracer, that response to travel the entire duration of time of 45 minutes to give you a better idea how the body's responding to stress. Okay? Pretty cool stuff. So, an example of a disease process by which homeostasis is disrupted. We mentioned a few. The most common one that what we talked about here was diabetes, and how it can affect specifically, certainly, blood glucose levels and the ability to control blood glucose levels, being either overly sensitive or less sensitive to insulin and glucose levels. That can cause major problems, and your ability to be able to determine with any problem, whether it's a receptor issue, an effector issue, or a control center issue, and where that issue lies, it gives us a much better chance to be able to not just diagnose, but be able to help resolve the problem and hopefully help the individual return back to normal health, normal status. And that is chapter 1, and on to chapter 2 next.